Cap Trio Gel, which has the 3 ingredients. And so if you have access to this agent, great choice from the get-go, from the baseline. The second thing is, if you see an adult female patient, and a lot of our acne patients are, of course, females, then we add spironolactone. And you don't have to push the dose. You can start with 50 milligrams once a day or 225 milligram pills. As you know, most of the current guidelines do not necessitate blood work. In the past, we used to check potassium levels. That is no longer necessary. And so again, combination of spironolactone with AviClear will, of course, lead to better results. Now, you'll notice oral antihistamines for flare management, and that's maybe not something that all of you do, but interestingly, there have been long known reports that when you have that acne flare, whether in the case of isotretinoin or in this case, in the case of AviClear, you can actually consider using one of the known antihistamines, and it can be helpful as well for flare. So something to be considered. Then, based on the panel recommendation, you wait. And so you wait at least 4 months. So you do the 3 treatments of AviClear 1 month apart, just like in the protocol. And then you wait for at least 4 months after the 3rd treatment to decide if additional treatments are necessary. And so commonly, the words that we use is likelihood of being a non-responder or likelihood of being a partial responder. And I can tell you that based on the group consensus, the proportion of patients who are true non-responders is actually relatively low. It's less than 5%. But again, you can't assess them immediately after the 3rd treatment. You have to wait at least 4 months after the last treatment, at which point you can make that call. Are they a true non-responder? But I will tell you that we also have a proportion of patients, about 10% of them, who are partial responders. And so these are the patients that maybe are a little bit improved, but not well enough. And so at that point, as you can see on this diagram on the left middle side, we can introduce additional AviClear treatments. And you can do a 4th treatment as needed, or as I showed you in the previous study, sometimes a 5th treatment. So by combining all of our best treatment approaches available, we can be very successful and effective in treatment of acne, much more so than just with monotherapy of either of those agents. And although it's not listed here, I can tell you that anecdotally, of course, in my practice, we even have had patients on combination of low-dose isotretinoin and AviClear. Definitely not routine, because most of the patients either have failed isotretinoin or frankly don't want to be on it in the first place, but we have done that in combination as well. And that's what I think makes this device so beautiful, is that not only is it universally accepted on a variety of ages, a variety of Fitzpatrick skin types, but can also kind of play in the same sandbox with all of the current therapies available for acne, regardless whether it's topicals or systemics. This is an example of another patient of mine who's a hockey player, 18-year-old guy. You can see his pictures at baseline, and then you can see what happened at 3 months. In fact, 1 month after the 3rd treatment in the middle. And although in certain areas, like in his temples, around his periorbital region, he has a reduction of inflammatory papules, we can also see that he still has population throughout his cheeks and upper cutaneous lip. So what else can we do? Well, I've mentioned all of the topicals. Of course, we can do that, but we have other devices. And so one of my favorite Cutera devices, in fact, what I consider is the gold standard for vascular treatments, is our XLV Plus. And XLV Plus, of course, has our 532 nanometer wavelength, as well as the green genesis and laser genesis, and can really be effective in reduction of the erythema. I use it for a lot of my isotretinoin patients, but I now have started to incorporate it for my AviClear patients to kind of reduce that inflammatory component. And then we also did couple chemical peels in him as well. And we can see that a combination of XLV Plus with a little bit of chemical peel, we follow him for now 6 months, so 5 more months, he's got the most beautiful skin. And not only is his acne better, but his actual complexion is better, his skin texture is better, his pores are reduced. And I think combining already existing treatments, in this case, a vascular device, a chemical peel, and of course, our initial AviClear, can really optimize the results and make our patients happy and kind of create this consistency that we can see over and over again. Now, we talk about acne on the face, but what about the body? Of course, if you look at the clinical studies, we know that nearly half of our patients, if asked, 50% of our patients have truncal acne as well. It used to be not as well known because a lot of the patients come to your office, you see the face, you don't necessarily ask them. But if you ask them, many of them have it on the body. And so the question becomes, what about AviClear on the body? And one of the constraints about it is the large size of the back and the necessity for a larger handpiece. And so I'm excited to tell you that Cutera has come up with a larger scan handpiece, which will allow for this faster treatment speed for larger areas, and of course can be utilized in this case for truncal acne. But there's much more than truncal acne. And so we have another very common condition that all of the dermatologists in the audience will know about, sebaceous hyperplasia, or enlargement of these very common sebaceous oil glands, often presents on the face with these yellow, what we call umbilicated little papules. And so they can be present on a variety of areas. And so the traditional approach is kind of mixed. Some people use a little bit of cauterization, like in my practice, maybe cryotherapy with mixed success, maybe CO2 laser, peels, isotretinoin, but there's no real standardization. But when you look histologically, you can see those very well-defined sebocytes within the arrangement of the sebaceous oil gland. And so we just learned that AviClear is so precise for sebaceous oil gland. Why not use it in sebaceous hyperplasia? And so some very preliminary studies have been done where 1726 nanometer wavelength with AviClear can be used for these devices, for these conditions. And so here you see a relatively small spot size of sebaceous hyperplasia with a zoomed up version, less than 2.5 millimeters. After one treatment, completely eradicated, very impressive. And here you see one that's a little bit larger, in this case, 3.1 millimeter. And again, with a single treatment, a near eradication with very, very limited residual of the sebaceous hyperplasia. So now we can really start applying what we understand the clinical aspect of this device towards other conditions. And then, of course, another condition, which I don't have any pictures, but is very devastating for our patients, is known as HS or hidradenitis suppurativa. Those of you who are not familiar with this condition, it's very devastating. Usually, predominantly affects women with these large nodules, cysts, and tracts that usually present in all of the sensitive areas like the armpits, the groin, under the breast. A lot of these patients are devastated. I happen to have a colleague in my practice, Dr. Pullman, who is really one of the key leaders on the HS treatment in Canada, and she's got more than 500 patients currently in her practice. And although there's a variety of new treatments like the biologics, those of you who are familiar, like IL-17 class, including Cosentyx and Bimzelx, that are surpassing the previous TNF-alpha inhibitor agents like adalimumab or Humira. Despite the innovation of those agents, these patients are still very devastated. Now, sometimes they benefit from surgical treatment as well, surgical deroofing or sometimes excisions, but there needs to be much more. And so, it's actually very commendable that Cutera, being a cosmetic company, is actually kind of going straight into this medical indication and potentially will have some exciting data when it comes to HS as well. So with that, I wanted to kind of finish and summarize. And once again, I understand that most of you already have this device and are very well familiar with the precision of both the wavelength and also the treatment, the indication that kind of spans the entire spectrum of acne treatments all the way from mild to severe, the safety that's applicable to a variety of skin phototypes on the Fitzpatrick scale, the continuous improvement with the results, which is not always immediate, but as I pointed out, as we wait for this results, it progresses over and over, and overall the durability and patient satisfaction. And with that, I would like to thank you, and that we have a couple minutes if you have any questions.
Thank you so much, Dr. Medalica, for sharing your expertise and insights. We do have a few questions from our attendees this evening, very engaged audience. So our first question revolves around flares. So acne flares seem to be common after or in between AviClear treatments. What are the recommended approaches for potential prevention and management?
Yeah, so I think, as I already mentioned, we expect the flares. So the first thing is to actually anticipate it and to tell our patients, because at the end of the day, if the patient is on par, it's much easier to communicate the types of treatments. Now, when it comes to flare, I do a variety of things. If it's a mild flare, I might just use a topical, and if you don't already have a concomitant topical, I might just give them one of those combination retinoid plus treatments. And so my preferred ones would be brand names, Captrio, or we have a Biacna gel, which is a combination of retinoid and clindamycin. So that would be the starting point. Of course, sometimes if it's really flaring, we need a little bit more of a systemic treatment. And so in that case, I might consider using a systemic agent like an antibiotic. And so sometimes I have to use doxycycline, my preferred kind of safest antibiotic, at least currently available in Canada. We know that in US, they have even more narrow spectrum tetracycline-based antibiotics. So in the case of doxycycline, doxy 100 milligrams once a day is my preferred choice. Some of my colleagues use doxy even 100 twice a day, BID, and you can easily do it for a month or two, and that will help to dampen inflammation. Now, very rarely, if that's still not enough, rarely you might consider, adding a low dose isotretinoin, which again might not be something that your patient is interested in, but if they are, if they're willing, this way you can do low dose isotretinoin. And as I mentioned, although that's not the standard of practice in my case, some of our colleagues on the paper they successfully use oral antihistamines to kind of manage the acne flare as well. And so usually with all of those approaches, I find that the flare is usually the worst in the first month post-treatment, similar to isotretinoin. And so with using these approaches, usually we're able to kind of mitigate it and control it.
So on the topic of systemic antibiotics, should those be prescribed in the cases of severe inflammatory acne 1 to 2 weeks prior to an AviClear treatment?
Yeah, like I mean, it all depends. Like what I find in my clinical practice is some of our worst patients, when it comes to the severity, actually respond the best to AviClear. And that's what the data shows as well. In fact, it's the milder patients that have a weaker response, especially if they're just comedonal. So if they have like moderate to severe acne, they actually do very well with AviClear monotherapy by itself. But having said so, if you want the absolute best result, then of course, combining it with a little bit of an oral antibiotic is probably going to lead to an even better efficacy. I think the challenge is, depending on the nature of your practice, certainly in my practice, is by the time they want the laser, they often have already gone through all of those steps and they've already tried the oral antibiotic. And so if that's the case, probably you're not going to want to keep on giving them more and more. But if you're truly seeing like a very severe acne patient and you're anxious or they're anxious about a flare, then giving them a little bit of doxycycline at the same time, I don't see an issue with that for a month or two, just to kind of dampen that response.
And I know we're coming up upon the hour, so this will be our last question for the evening. After 1 year out, if the acne is starting to come back, how many sessions would you recommend for retreatment? And how long could you repeat that time frame in which physicians should potentially do the reevaluation or evaluation of how many treatments or the treatment course?
Yeah, like absolutely. So I think again, like we're talking about like 1 year. I think the question is after the last treatment. So if they get a flare, I think at a minimum you would consider doing at least one more treatment, and then you would bring them back after a month. And then at that point, if after a month you're not noticing any improvement whatsoever, then it might make sense to do another treatment. If you're noticing partial improvement, then depending on the willingness of your patient, it might just make sense to just give them another, month or two before you rush into treatment number 5, because you're already now at treatment number 4, and then based on that reevaluate. But I think the key is, even after the completion of your 3 treatments of AviClear, maintenance is absolutely critical. So having some form of topical retinoid ideally would be indicated. And I think by doing that, you will significantly reduce the likelihood of flares in your patients.
Well, thank you so much, share viewers, for attending tonight. If you have any questions, please feel free to reach out to mktgadmin@cutera.com. Thank you so much again, Dr. Medalica. This was wonderful. Thank you for your time tonight, and we hope everyone has a wonderful evening.
Thank you so much, Erica, and thank you to Cutera for making this happen.